Hi everyone and welcome to week 5. Our competencies for this week include identify and explore 2 legal documents relative to the end of life, articulate the consequences and potential conflicts in the absence of legal documents related to the end of life, explain how ethical behavior of a healthcare provider influences the quality of care given to consumers, and to differentiate between the law and ethics in resolving a healthcare case study. For this week's assignment, it might be helpful for you to research the definitions and the differences between euthanasia, physician-assisted suicide, and palliative sedation. And as always, please email me with any questions about this week's discussion, question, or assignment. I wanted to talk a little bit about some of the harrowing questions and ethic dilemmas that happened during Hurricane Katrina, especially as far as healthcare. 5 Days at Memorial is a book written by an author called Sherry Fink. She actually won the Pulitzer Prize for writing this book. It examines what happens when people make life and death decisions in a state of anarchy, and that's exactly what it was like at this Memorial Hospital during Katrina in New Orleans. So, on August 25th, 2005, Hurricane Katrina made landfall as a Category 3 storm. The windows at this Memorial Medical Center shattered, but the facility itself remained functional, so the staff figured, wow, we dodged a bullet. Most of the staff, as they had done in all of the other hurricanes that happened in New Orleans, had family there at the hospital to help keep their own family safe, and a lot of them had brought their pets in. The hospital allowed them to keep the pets in pet carrier boxes in a certain part of the hospital so that they would stay safe as well. But then the levees broke, and Memorial's backup generators were located at ground level. So floodwaters poured into the streets. The building was plunged into darkness. Life support systems and other essential medical equipment shut down. There was no air conditioning. The temperatures rose. Food, water, and medicine dwindled. A lot of the food spoiled because the electricity went out, and there were no working sewer systems. People that were inside the hospital could hear gunfire outside. There were people, as I said, it was pure anarchy, and there were people that were outside actually trying to get into the hospital thinking that they could get access to drugs. Hospital was left in chaos. It was stifling, stinking of sewage without power or running water. And doctors and nurses and other healthcare providers faced a terrible dilemma. Which patients should they save first? So the corporation that owned the hospital, which was called Tenet, had no evacuation plan. Hospital staff repeatedly sent desperate emails to them begging, we need to get patients out of here, with no answers. When the answer finally came, it simply read, we have been told getting into the city is not going to happen. Have you contacted the National Guard? So the National Guard was also helping out every other person in the city of New Orleans. And there were many other hospitals, nursing homes, other healthcare facilities. This is just one picture of one of the corridors in the hospital after the bottom of it flooded. A picture of some of the National Guard people who were actually guarding some of these hospitals. So, Tenet's corporate negligence, the author suggests, bordered on criminal. Thousands of staff, patients, and evacuees were trapped by floodwaters inside the building awaiting evacuation by either an airboat or a helicopter. Here's a picture of a nurse fanning some of the patients. They had transported a lot of the patients up to this area where they would be able to get rescued by a helicopter if one would be available. And remember, it was actually even hotter inside the hospital than outside the hospital because of the air conditioning. This is also, this picture also shows how they identified patients. This patient was a DNR and was categorized as a 3. it was how they were rating patients to be rescued. This picture shows the harrowing journey that they had to actually make by carrying the patient up these stairways to get them up into the rescuing helicopters. There were a couple of patients that they had in the hospital that were over 600 pounds, and they just, with the manpower they had and the way that the workers were exhausted, they just couldn't get them up there. Again, onto the waiting helicopter. And this picture shows how some of the patients who were able to ambulate were taken by airboat. A lot of the patients who were ambulatory and were able to get onto these boats were taken to the big convention or conference center that a lot of the other residents of New Orleans were in, and the circumstances there were actually much worse than at the hospital. And here's some folks that were just being rescued by people in rowboats, little motorboats. So the author described the unconventional method of triage adopted by the medical staff, where ambulatory patients were prioritized for evacuation and those with do not resuscitate orders were placed last in the list. Patient evacuation began on the third day and progressed slowly until the fifth day, when some medical staff decided to hasten the deaths of critically ill patients, believing they would not survive, with lethal injections of morphine. So without ventilators and other medications and other equipment, a lot of these patients were doing very poorly. And doctors and nurses didn't think that they were going to be able to survive the journey up those stairs and onto a helicopter. And actually, they didn't even know where these people were being taken from the helicopter. So one of these doctors, Dr. John Thiel, had no time to provide what he considered appropriate end-of-life care. He could not justify hanging a morphine drip and praying that it didn't run out, according to the author. So Dr. Thiel assisted another doctor, Anna Pau, who actually was a surgeon, and several nurses, doing what they believed was the only ethical thing left. They injected the most critically ill patients with lethal doses of morphine and sedative shortly before the entire hospital was evacuated on the fifth day of the crisis. So they euthanized people. "11 months later, as New Orleans staggered back to life, Dr. Pau and 2 nurses were arrested and charged with principal to second-degree murder. The public was largely outraged over the arrests. It was the Tenet Corporation, the government, and overall leadership that should have been put on trial. And in 2007, a grand jury agreed, and the physician and the nurses were not charged with murder." The book examines the legal and political consequences of the decision to euthanize patients and the ethical issues surrounding euthanasia and healthcare in disaster scenarios. So I leave you with that, just to kind of think about and mull over. What are your thoughts about what happened there? What are your thoughts about what happened in the trial afterwards? And I do recommend that you read the book. Very good. This author, Sherry Fink, does a very good job presenting it in an unbiased manner. So were these people trying to comfort these patients or hasten their deaths? That's the question. So I will see you online, and we will move on to week 6.